Okay, so Assalamualaikum warahmatullahi wabarakatuh and a very good evening to everyone. So let us begin by introducing ourselves first. My name is Ainadira binti Muhammad Suhaimi alongside my partner.
And my name is Humaira Zainal binti Ahmad Saidi. So today we will be presenting on a topic titled Anterior Cruciate Ligament ACL Reconstruction Cases. So we will be looking specifically at the types and trends in concomitant procedures performed during these surgeries. So for the first slide is introduction. So, as we all know, ACL injuries are common, especially among athletes. These injuries often require surgery known as ACL reconstruction. However, in many cases, other procedures are done together with the ACL surgery. These are called concomitant procedures. Yeah, so in our research, we analyzed the percentage of ACL reconstruction cases involving meniscus debridement, meniscus repair, microfracture, chondroplasty, and collateral ligament repair. So personally, this topic really hits close to me because recently my brother had an ACL injury during a football match. He fell on a slippery field that led to the ACL injury. So as a physiotherapy student myself, I was curious to learn more about how such injuries are treated and what determines the type of procedures are used. So the next slide. Sorry. So for the background and importance, so let's briefly define ACL reconstruction. According to MedLife Plus, it is a surgery to reconstruct the torn ligament in the center of the knee using a graft. According to Physiopedia, this procedure helps to restore knee stability, maintain full active range of motion, and ensure proper ligament function. So our main focus today is to highlight a pattern which is meniscus debridement is the most common additional procedure during ACL reconstruction, and its usage increases as the patient age increase. So now let's look at the first chart. The data is taken from a study by Nicholas Sevelos and colleagues published on ResearchGate in 2021. This chart shows the percentage of ACL reconstruction cases that involve various concomitant procedures. So as we can see here, the x-axis show the specific type of additional procedures performed, while the y-axis indicates the percentage of ACL surgeries in which each was performed. As shown, meniscus debridement is the most common procedure done alongside ACL reconstruction, as it has the highest percentage compared to the others like meniscus repair, microfracture, chondroplasty, and collateral ligament repair, which had the lowest percentage. So, according to the chart, meniscus debridement accounts for 44% of cases, making it the highest percentage of ACL concomitant procedures. And while meniscus repair follows with 11%, and microfracture for 5%, and chondroplasty is 4%. And lastly, the collateral ligament repair is 1%, appear as the less frequently. Sorry. So from this chart, this clearly shows that meniscus debridement is by far the most frequently chosen additional procedure. On the other hand, collateral ligament repair is the least common, indicating a preference for simpler and possibly less invasive option. So, in conclusion, this clearly indicates that surgeons frequently choose debridement as a complementary procedure due to its simplicity and effectiveness. So that's all from me. I will pass it to Ain.
Alright, so thank you, Humaira. Now let's move on to the second chart, which shows how the type of meniscal procedure during ACL reconstruction changes based on patient age. So this data is obtained from the same study by Nicholas Sevelos and colleagues in 2021. So the chart compares the use of meniscus debridement and meniscus repair across various age groups, from under 10 years old to 70 to 79 age range. So the blue bars represent meniscus debridement, while the orange bars represents meniscus repair. Starting from the youngest group, in patients under 10 years old, meniscus debridement is performed in approximately 10% of cases, while meniscus repair is around 0%. In the 10 to 19 age group, the frequency of procedures increases. Meniscus debridement is seen in 32% of cases, while meniscus repair reaches its peak at 17%, which is the highest percentage across all ages group for meniscus repair. So this indicates that younger patients are more likely to undergo repair due to better healing potential. So moving on to the 20 to 29 age group, debridement rises significantly to 38%, while repair declines to 12%. In the 30 to 39 age group, debridement continues to increase, reaching 44%, and repair decreases further to 8%. For those aged 40 to 49, debridement climbs again to 52%, while repair falls to 6%. In the 50 to 59 age group, debridement jumps to 63%, with repair dropping to 4%. Among patients 60 to 69 years old, debridement reaches 72% and repair falls to 3%. And finally, in the 70 to 79 age group, meniscus debridement peaks at 76%, while repairs is completely absent at 0%. So conversely, the rate of meniscus repair decreases with age, eventually dropping to 0% in the oldest group. So this chart clearly illustrates a trend. As age increases, the use of meniscus debridement rises steadily, while meniscus repair becomes less common and eventually disappears. This pattern suggests that younger patients are more likely to receive a meniscus repair, probably due to better tissue healing and regenerative capacity. So older patients, however, tend to undergo meniscus debridement, which is often faster and more suitable for age-related joint conditions. So this age-related trend is important for clinicians when deciding on the most effective surgical and post-operative approaches. Yes, sir? So in conclusion, ACL reconstruction is a vital surgical procedure for restoring knee function. It helps in stabilizing the joint, maintaining full range of motion, and ensuring proper ligament performance, as cited by Herzog and others in 2018. So the findings we presented show that meniscus debridement is the most common concomitant procedure during ACL surgery, and its use increases with age. So by recognizing these trends, healthcare providers can tailor treatments more appropriately for patients of different age groups to ensure better recovery and outcomes. That is all from us. Thank you for your time and attention.
All right, thank you very much.